I will just try to give you an idea how to approach your preparation when you are targeting any MCQs based exam. Actually, how many people think that preparing an exam for MCQs is different from Viva or written? Any volunteer, please. Yes, Dr. Ifa.
Scale of reading the topic, because even if minor issues या कोई concept नहीं clear हुआ हुआ secondary to a topic, it's going to be very difficult to answer an MCQ because you have 5 options that you have to start ruling out, and that's where the difficulty comes in.
I'm sorry. Actually, I was mute. I didn't know that I'm mute. Actually, can you hear me now?
Yes, clearly.
Yes, actually,
Yes.
what I said, I'm sorry, I was mute. I didn't know that I'm mute. So the thing is that the same knowledge you want, that is for any MCQ exam or written exam or Viva exam, because the baseline is the same. Okay, so if you are you are appearing in any oral exam, same thing you have to explain. Okay, if you are in a written exam, the same thing you have to write and a little elaborative thing. And if you are appearing in MC, choose the best or the true false, you are just having the same thing asked in a different way. Okay, so I will just give you an example. Just a second, let me share the screen. Okay, this is an example of a true false. Okay, so maybe you will have similar question to that one in the choose the best question as well. Okay, but what will be then, that all other options will be wrong and only one option will be correct. Okay, or they will be asking you a question in management, that what is even in management, if they ask what is the best thing to do and what is the first thing to do, actually these two will be the different things. Okay, but when you are preparing for the exam, I think understanding the true false is much better way of targeting than choose the best. Okay, and actually I'm not in a comfortable environment. There is a disturbance around me, so that's creating hurdle for me. Okay, so you see, if you just target on this question, okay, ketamine, and just give me a second, Abu Bakr. Okay, okay, so if you are targeting this thing, what is the way to target? My concept is that when you read about it, ketamine has a pK of 7.5, has two geometric stereoisomers, more lipid soluble than thiopentone. These 5 points. Now if you, rather than just trying to answer, maybe you know one of them or you don't know anything, so go to the explanation, okay, and just have a look here. Like, you make your notes like that ketamine, phencyclidine, so this is the tribe of the medication, so you just make your notes like that. Indications in GA, as well as it has analgesic properties, it is dissociative, maybe some, it is written here dissociative anesthesia, airway is maintained, okay, cardiovascular stable. Okay, so when you are studying it, some people just try to just understand, just try to cram what is the true answer, okay, but I will ask you to just, like, you will, out of this one paragraph, you will find 5 or 6 points. You just make in your diary that these are the 5 points which I learnt about ketamine, okay. Then in such books you can go, like, you will have a source, and ketamine you will find it in the 2003. I have made the link, and you can find in 2003, if you go to the year wise folder, you will find in 2003 this ketamine article, or you, whatever book you are reading. So like, the another buzzword for this one will be NMDA receptor agonist, okay, it's acting on NMDA receptor antagonist, okay. It also has local anesthetic properties, okay. It has, if you want to, for example, this is just not written here, I'm just telling you that if you want to reverse, if you had only given ketamine and patient is not reversing, you can try with naloxone, though it does not happen, but if you have given overdose of ketamine, you can reverse it with, even with opioids. So just giving example that it has effect on opioid, it has effect on nicotinic receptors, okay. So out of this paragraph, you will have, 5 or 6 points which will be important for you to memorize, and then you will build up the knowledge, and then what will happen when the MCQ related to ketamine will come, you will be able to answer it. So the point is that you should be doing a thorough study in that way that you are clear about one subject. That is the only way to, if you want to be sure. Unfortunately, what happens now, Aqsa, anyone who is preparing for exam, what is happening actually? Happening actually is that there are two extremes. There are some people who are reading Morgan baselessly, aimlessly, just cramming the words, just trying to highlight with the highlighters, and at the end of the day they don't know anything. Because what is the problem, that you are not able to identify what is the more important thing, what is the less important thing. And another thing, some part of the knowledge is written in one part of Morgan, and the other part of the knowledge is written in the end of the Morgan, and there is no collaboration, there is no interaction, there is no integration. So that's problem, that when they ask the question, it is based on the link which is missing. So you are unable to to concentrate and focus, and you are not able to identify the correct answer. So my first message to anyone who is even appearing for choose the best questions, I will suggest you to read true false first. It will give you a great knowledge, highlighted points, and you don't have to read it again. You don't have to cram it again. You just have to extract like a honeybee, and you will make 5 or 6 points out of it, and you will not open it again. You don't need to open it again. Okay, so first message for you people like that. Then because I opened with the true false question, if you open clinical science, for example, okay, so again you will find these books here. Because I'm focusing on true false, my first message for you people in this, because all of you are in love with BCQs. Okay, sorry, if any question or any comments, please raise the hand. Okay, so like for example, like this is true false. All you have to consider it true false. You are not appearing in true false exam, but I'm asking you to study like that. So what you will be doing, that you have to you have to exercise your brain. Okay, so first of all, the first point which you need to understand in this one is that whether it is class 1 obesity or class 2 obesity or class 3 obesity. Okay, can anyone tell? What about BMI 30? What is it? Aqsa? Or anyone please? Azhar? Who is there? Aqsa, sorry, Rifa, I just want to tell you that because in Pakistan you people are not familiar with the true false. Okay, so some of the things I'm not sure recently in FCI exam they are asking true false or not at the moment. I think they also have switched to choose the best. But for preparing, I will suggest all of you again that you have to tune like this. Like for example, you in this MCQ you are reading, just you are doing practice. So you have to just shock out the buzzword you need to know is that what is the classification of BMI, whether it is class 1, class 2, class 3. And the other point, mechanism of halothane is greater compared to the metabolism of halothane is greater compared to non-obese patients. So you have to know about it, that whether the obese patient, do they have higher metabolism or slower metabolism. Okay, or you can just have a look what is the change in pharmacodynamics in obese patients. So you can just open the book and just focusedly you will be looking at not only halothane, what is the effect of on metabolism in obese patients. Okay, so this will be the learning point for you. Okay, it will take time, believe me. You will not be running through the MCQ, that you are just you're trying to find the queen. Who is the queen? That's what you people do, unfortunately. Maybe it is exceptions are there, but majority of the people, they are only interested in knowing what is the answer. What is the answer? What we have to mark in the exam. But unfortunately, this is the worst way of understanding the questions. So if you understand these are practice books. These are not the question books. So if you want to think that examiner will open this book and make the question out of them, so it is not like that. Especially the people who are international exam, they will never do like that. Yes, our part of world where our system is not as developed as there in any best part of the world, maybe you will find some of the questions being copied from such books, but they will change it, I guarantee you. They will never copy it 100%, or even for example if they are doing 100%, you cannot trust on it. Okay, so if you would think that you are opening a book and you are thinking that the same question will come, you are in a negative frame of mind already. So even if you think that it is happening, even some people say that there are questions coming from XYZ book, Josefa, or etc, you should not trust it, because that will make a dig for you where you will fall down. So that's what my message is, that how you should be learning, that you will be making some points out of it and you will be exploring out of it. That another point is, for operation of normal time duration, recovery from volatile agents is increased. So it is actually not increased, it is decreased, because volatiles, they go in the fat and it takes more time for coming out. So that's how you will be learning that what is the change effect of volatile agents in obese patients. You can open Google even and see effect, you will write effects of volatile agents in obese patient. Okay, so that's my suggestion. When you are making it in blocks rather than you are trying to cram the topic, believe me, maybe you will be thinking what the hell you are doing, but after 1 month, if you just revise them, you will come to know that how much knowledge you have gathered. And these things, there are two options. It will be good for different people, different option. One option will be that you record in an audio note. You can record in an audio note that I read this MCQ and these were the points which I learned from that MCQ. These were the things which I need to probe down and I saw and I find these answers. This is one option for them. The people who are junior, I will suggest that do read MCQs. Rather, they can have a research on one MCQ and to see what is there in one MCQ for you. And they can make notes by writing. For some people, writing will be okay. For some people, recording will be okay. And you can save it in your mobile or in Google Drive with the day, this day you did that thing. And anytime when you are not reading, studying, you can just listen to that audio and that will be your revision. Okay, so that is my suggestion for you. You will find a lot of knowledge from true false. Okay, so this is all these books are arranged that like in MCQs world folder. You will find this basic science MCQs, best choice. I will come to this best choice. I have opened these two folders, and actually these are all similar books. Okay, all are similar books. Some which I have read, number one, maybe I found it better. Okay, but actually they are almost the same. And in clinical science, I will suggest you one thing, that if they are telling about any management, that may be like, for example, if they are telling something about the management, that is Cubase is a very old book. So maybe the management you should not follow. Any statement which is in Cubase about clinical sciences may be changed now. Like for example, sepsis management or cardiac arrest management or difficult airway management or anything that may be changed. So you have to verify, confirm it. Okay. So these are all books are there. You can read one book and then make notes, and then you will find that second book, your percentage of answer questions which you read are better. Then in the third book, you will find even more answers. That like you when I appeared in Irish fellowship exam, this was one of the book which I read a lot. Okay, actually I just did this MCQ based preparation. Okay, so but I cannot tell that the questions came from this book, but this book was a very good launching pad for increasing it, to start the things. Okay, so you will find, for example, leak factor, increasing chances of stent thrombosis include like diabetes, renal impairment, stent length more than 18 millimeter, low ejection fraction, young age. You will find questions like this. Okay, so you should not be relying, you don't need to cram, you just need to pick out the points and make it notes in the form of writing or oral. Okay, and then best choice. Okay, these are actually American books. These choose the best pattern is in American books. Okay, so this book so this book is the same new edition of Brian Hall. So this is one of the book you should be reading. Comprehensive, this is a very good book. Okay, this book is very, very good for practice. What is the advantage of this book? That for example, if you go into any of the chapter, some of the people you have already read this book, so you will find that the same thing they are actually, for example, if they are making the keywords. Okay, so that's what I want to tell you, that this is actually, you can use this book as a base on which you can add things. Okay, you can have a print of on one page, and the back you can add the things which you read extra. Okay, so this book I will highly suggest you while you are preparing. Even the people who are junior residents, I will suggest you to at least read some of the MCQs based knowledge. You will find at least one, this Bryony Hall and Anesthesia Comprehensive, this Lippincott. Okay, and this is a very book, same author book for pediatric, and there is one similar author book for, actually, you know, I sometimes I'm unable to compile it and correct it, because some of the file I have, you see, I am unable to fix them, but actually you can find 4 or 5 books and then you can read. Okay, another portion I will highly suggest you is this book. Okay, this is for regional anesthesia, but I tell you, because regional anesthesia is there in every case. Okay, so if you want to extract knowledge from it, what is the best thing? The one thing is that the pattern is very simple. Okay, and another good thing is that they have not put too much details. They have just remain very. The only thing, remember one thing, that this book was a little old one, which was, you can say, pre ultrasound era. Yeah, like maybe I think this book was published in 2012 or something like that. Okay, so the only thing which you don't need to do is that they have put more than one approaches for a single nerve block. Okay, so you don't need, if you go to this chapter of this upper like this, for example. Okay, this peripheral, I don't know, maybe this book is not in a good PDF, but you can open it. If you go to this chapter, you will find 4 approaches for supraclavicular block or 4 approaches for interscalene block. You don't need to do it, because that will never come in anesthesia exam. Okay, in this era they will be focusing on ultrasound guided approach, or you need to know at least one approach. You don't need to cram each and every approach, but otherwise I will suggest you, all of you who are appearing for any anesthesia exam, to read this book. This is very, very good book. You will find concerns in specific population, like you will find concerns related to old age people, pediatric people, pregnant people. The questions are very nicely written. I will show you some of the questions, you will come to know. Even there are questions about, for example, do you see, there is very good anesthesia, this analgesic pharmacology. Okay, so you can have on a look on these questions. Okay, you know, any question or any point. Show cover page of this book. You are asking about this book, Rifa? I'm sorry, I just saw your message. Okay, so this is Masterpass. Okay, this is Masterpass. This is Masterpass. This is very good series, I see, and as I told you, my friends know me, who knows me. I love this book. I really love this book. This is very, very nice book. Let me show you. See, it was I was correct. It was printed in 2012, so at that time maybe less questions were being asked about ultrasound. If you want to have a look some aspects of ultrasound, actually I don't find a proper PDF, so I had this hard copy, and I scanned whole of the book, just not to say anything good about me, but I'm telling you that if you want a commitment to your profession, believe me, you can do anything. There were about more than 200 pages of this book, and I scanned each and every page, make it in chapters, and I uploaded it. Okay, so I think what I felt, because this book I ordered from Amazon, it was quite expensive book. I had hard copy of it, so I thought I have justified the amount which I paid, because if you people not open it, not read it, my effort is useless. Okay, like for example, if you want to know about this adductor canal block, okay, you will find You will find some view as well, you will find some MCQs about it, so you will be able to understand it very nicely. Okay, it's also very simple, it's not a very difficult book, by the way. It's not to tell, it is practice book. It is not you can say that again the same, that you will not find queen as you people are in habit of finding the queen, that who, which ones, from which sir, which book examiners are choosing to make the questions. I'm sorry, this is not this is a book related to pain medicine. You don't need to, because pain medicine is a special subject, but if you want to learn some of the topics, you will find it very nicely. Like for example, an anatomy of the this this one, some of the questions related to the basic concepts about the pain, you will find it very nicely. Okay, like pain physiology, it's there right here. Okay, actually every book has you will if you want to have some more detail, there are some people ask me about European diploma in regional anesthesia. Okay, so if you want to appear in European diploma in pain medicine or European diploma in regional anesthesia, you will find these books, because actually I did 2 diplomas in regional anesthesia, and this book I wrote, this book and this book, and some of the aspects from this book. Okay, so actually I found them very nice. So some people who are appearing in European diploma intensive care, so these are the books for related to ICU. Even if you are preparing for even for anesthesia exam, you can open some of the chapters. Okay, of course there will be too much details. Okay, but if you just want to have a sniff of the book on from some of the topics, like for example, one thing I tell you, that in usually in anesthesia exam they don't give CT scans or MRIs, but in these exams actually they put these CT scans and MRIs as well, because they want specialization in ICU. So you will never find these in our exams. But if you just, again, this is a good practice for residents, because you have all the time in the world. If you want to read, you will get a lot of benefit out of it. Okay, so these are ICU books, ICU MCQs books. Okay, so I tell you something, that though I am my main focus was to tell you about MCQs, but I tell you again that if you want to I will just give an example of I was just taking another. If you want to study about thyroid, okay, the first thing you should be starting is from the surface anatomy. Can any one of you, because I cannot, maybe I am not able to recall it, what is the level of vertebra? Rifa, you have recently passed, can you tell? Rifa is here or gone already? Yes, Rifa, can you tell the level of vertebra? I'm sorry?
Thyroid, you're asking about thyroid, right?
Yes.
T5 to T1, the level that
I
it
cannot
extends from.
recall, but I'm just giving you a hint that you should be knowing about because there may be some MCQ which is based on the surface anatomy. Okay, at what tracheal ring, and there is one are lobes and one is isthmus. Okay, so they can have ask what is the level at which thyroid lobe and thyroid isthmus will be there. Okay, then the other thing which they can any question about it is arterial supply, venous drainage, okay, and the nerve supply. Then how thyroid hormone is synthesized, hormone synthesis. Okay, so you should be knowing how iodine is trapped from the intestine, then how it is transported to the gland, okay, and how there is iodination, okay, and how there is unification to make it T3 or T4. Then any question will be that which is the most part which is secreted, which is the conversion, how it is converted. So all the mechanism. So any MCQ which is coming to you is on this. So if you want to understand, you have to do like this. and then what is the action of thyroid hormone. Okay, how thyroid hormone acts on the cell. So and then which systems are affected in hyper or hypo. What is the role of hypothalamus? What is the role of pituitary? Okay, and then the next step will be what are the different pathologies. Like you can say what are the causes of hyper and hypo, and then what are the clinical sign symptoms. Okay, and you can just track it up to all diseases. This is true for all diseases: CNS, CVS, respiratory system, endocrine, neuromuscular, electrolytes. This is not only true for hypo or hyper. You just rather than reading from the book, maybe in one book they have not written anything about electrolytes, it doesn't mean there is no change. Maybe there is no change, but if, for example, if that book has not written, you should search about it, because maybe you will find some MCQ which is about electrolyte change in hyperthyroidism or hypothyroidism, for example. So why you will be in trouble? Because you have not used your brain when you are studying thyroid. So if you understand the thyroid topic in that way, I can guarantee you that if you are being asked in MCQ, written, Viva, Towski, etc., you name anything, I guarantee you will be knowing the subject, and then pathology, clinical signs, symptoms, and then pharmacology. Okay. So whenever you are reading any pharmacology, you should be knowing what is the mechanism of action, what is the main the generic, like not generic, or you can say that what is the tribe of that medication. Okay, like what is the chemical structure of that medication, then what is the effect on different systems, and especially because our system is related to either CNS, again same thing, CVS, respiration, liver, kidneys. Okay, so you should be, rather than understanding any pharmacology in a blind way, just think about it. Is there any effect on your anesthesia management? So any medication or any disease, usually what is our anesthesia related to? Airway. Because we are affecting anything related to CVS, the patient is already taking a medication, and your medication is adding insult to the injury. Okay. So you will be considering about CVS. Your all medications are metabolized or released from liver or kidney. So you need to know whether this disease pathology or that pharmacology is affecting your related systems or not. So rather than reading the book blindly, try to find the answers of these questions, which are common in any disease you are studying, any pharmacology you are studying. You should be knowing in that way. And then the side effects. Okay, and the chunk, important thing, like for example, if you want to read about this carbimazole, for example, so what is the relation to it? Anesthesia, that it can cause bone marrow suppression. Okay, so there will be anemia, there will be neutropenia. Okay, if I'm not wrong, there is a granulocytosis occur with it, if I'm, just correct me. Okay, so this will be affecting your anesthesia management. So if the patient is on the thyroid patient, you should be knowing about it. So please try to re-study like that. Please come out of the vision of only reading the book blindly. You are not in class 5. You are not in medical college that you are studying physiology and you are doing research on physiology. You are, anesthesia is a subject about which no single book is perfect. Just tell me one single book in which thyroid is written in that way, because in the exam you need to know in that way. Then again, if you undergo the thyroid surgery, what are the approaches, what are the things which you need to know. Then airway management in thyroid patient, then complications. Okay, how to monitor recurrent laryngeal nerve intraoperatively, what are the possible post-op complications, and things related to parathyroid. Okay, so if you want to understand thyroid and you want to know that, you want to be sure that anyone, you would sit in a public and ask, challenge them, ask anything about thyroid. If you read in that way, I can guarantee you that you will never fail a question about thyroid. But for that you need to study like that. If you want a shortcut, best of luck. Maybe you will get through. People pass by studying pool of MCQs, pass the exam, and then I will ask this question to all of you. Would you like your mother, father, brother, sister, son, daughter, wife to be anesthetized by a person who has studied like that? Answer, all of you, please. Anyone would like to do like that? I don't think so. Nobody will be happy to be anesthetized in that way. So I will suggest you, please, studying is just like doing any prayer, any ibadat. Okay, if you try to find out shortcuts, believe me, maybe you will pass the exam, but you will be in trouble in the practical conduct of anesthesia. And the base message for you is that try to be methodical. Okay, try to be methodical, and then you will be able to understand and practice everything. Okay, so another thing I want to tell you that I have sent this message many times, but I will again, maybe this time it works. These are the review books. Okay, but believe me, if you even some people will say, oh, first year resident, this is for FCPS oral exam, why are you asking me to study? But believe me, if you study from this book right from the start, I will just give you example how to use this book, and you will remain maybe on first page number 1 for 10 days maybe. Okay, like if, for example, you open this book and you open this first case, you are having a 70-year-old male underwent abdominal aortic aneurysm. So first, you will not move forward. First of all, what is concerns related to 70 years old? You will stop here and you will try to have the concerns related to elderly patient. Okay, anyone wants to tell about concerns in elderly patient? There are physiological, pharmacological, anatomical changes in an elderly patient. So this will be a brain exercise for you, that patient will have problem in, like they maybe have hearing problem, they maybe have visual problems, they may be hard to communicate with, they will be have difficult IV lines, because there is you just imagine a old man coming to OR. You will have all these problems. There will be problem in positioning. This old man can get hypothermic. There is decreased metabolism. There is decreased GFR. There are problems related to airway. They are maybe edentulous. They have difficult airway in that way, and they have less closing capacity is high. They are prone to become hypoxic. They have limited cardiac reserve. So things like that. Okay. So if you just revise these things while you are studying this question, I guarantee, or maybe in one go you know 5 things, 10 things. In other case, you will go and you will add on your knowledge. So it's not like you will become expert. Have you seen a surgeon doing a laparoscopic surgery on day 1? No, never. The first day they are only looking at it. So you are doing the same thing, but the way of studying is like that. Then you will go to abdominal aortic aneurysm. Maybe for first year resident, abdominal aortic aneurysm may be a very big thing. But if you just think, the base thing will be this, that there are chances of bleeding. If you forget everything, if you only remember that abdominal aortic aneurysm, if it is ruptured or if it can rupture, there in any case there are things related to bleeding. So I have to think what I should do if bleeding occurs. Then you will go in the next step. You will be thinking that how to manage a patient with bleeding. Okay. So you will day one maybe you only just understanding how to approach about it. Maybe you are only thinking how to take big IV cannulas, how to take use of cell saver, how to have massive transfusion protocol, how to use blood and blood products, things like that. So but you will have vision that I have to understand things like that in that way. Okay. So then in hypertension, okay, ischemic heart disease, then you can just think that what are the problem in the hypertension, what are the problem in the ischemic heart disease, and gradually you will come to know. You will only extract buzzwords like simvastatin. What is simvastatin? First reading or first thing, maybe you only know that it is this lipid lowering medications. Okay, so and you can just Google what is simvastatin. You will find it is this mechanisms, this, and the first thing and foremost thing you will be learning that there are concerns related to this patient, that there will be disturbed liver enzymes, because your brain will be studying, your brain will be acting that what is effect on brain? No effect. Any effect on cardiovascular system? It is good for cardiovascular system. Any problem with respiration? I don't think so there is any problem with the respiration. You will stop on liver. It disturb the liver enzymes. So if the patient is taking simvastatin, I need to see the liver function tests. Okay. So this is the way of study is called retrospective learning. You to try to create a questions and then find out the answers. So I guarantee you that if you I tell you that maybe you open it and you stop at 70 years old, and you may take a few hours to study about elderly patient, but if you go step by step, and you will find a lot of learning material, because actually the books which we usually study are never written like that. They are not case based, study based like in that way, and usually in our training, usually we are not being taught like that. We are not being taught on the patients like surgeons are being taught surgery on the patients. Unfortunately, we are given lectures, very beautiful slides, and this is not actually the correct way. Okay, and that's why when you reach the exam time, you will find it in a different world, because the MCQ will not come from page number 87 of Morgan, and you will be in trouble. So why not you change your approach today, so that you don't find it difficult when you are on the business end. Okay, so actually this is what I wanted to share with you. Any questions, please? Anyone wants to have any comment, anything you want to ask? Because when you are studying MCQs in that way, I again tell you that maybe you are thinking what I am doing, but it's a slow gradual process. I guarantee you that after 1 month or after 2 months, you will understand what I am doing. Because what will happen, the things will come on repetition. Okay, so this is what I suggest you to study. I did not study till when I started studying like that. Then I came to know what torture I was doing on myself, because I was just trying to cram the pages of Morgan, and then if you are thinking something good, you are going to problem oriented, and then you are thinking something good, you are going to anesthesia coexisting disease, and when you are asked a simple question, you are unable to answer, because there is no integration. I again tell you. So try to integrate, try to read from articles, and try to get the learning points from these books. Similarly, the review books, and similarly these SAQs books. You will find a lot of knowledge, I tell you, from these books. Okay, like these are new form constructive review questions, CRQs. This is something new. When I appeared in these exams, this pattern was not there, but actually these are very short, small questions. And just a second, I will show you. List 2 obstetric features which are commonly associated with postpartum neurological deficit. Okay, things like that. They are very, very specific. Lateral cutaneous nerve of thigh, common mechanism of injury, lithotomy position, things like that. Okay, sensory and motor deficit, where it occurs, it is usually only sensory, things like. Okay, so this will give you a very good practice for studying. Okay, and again, maybe it looks weird, but I tell you that if you study retrospectively, you will have hell of knowledge. Okay? So I think nobody's interested in asking any question. So Shamail, would you like to ask anything or comment anything?
Yes, like I have just started studying, so when I will solve these MCQs, then how can I search on these things uh, from
I'm
those
here to help
chapters
you.
that I have
I,
gone through?
I invite
Okay.
all of you, any question you can ask any time on WhatsApp. Or I am inviting all of you. But I tell you that you can, if you use your brain, I guarantee you that maybe only you will just need a small guidance. Not ordinary people reach up to the moment where you stand, because in our setup we are being suppressed. We are saying you are first year resident, no 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 no, you should be reading the first 18 chapters of Morgan. They are not telling you the vision. Unfortunately, I fail to understand that what are you getting by reading pharmacology separately, physiology separately. Is there anything which you are only reading for the sake of physiology? No, you are becoming a specialist. So you have to integrate physiology, pharmacology, if there is something related to physics, and then at the end you will be getting a result. Okay? So try to make Google your friend, because Google is available 24/7. Whenever you ask any question, Google will answer you. Even Dr. Zishan is not there to help you out, or any XYZ senior is not there to help you out. Google will always help you. Okay, so if you check in Google, if you, for example, you find, if you want to be sure, because people say there are so many things which open and we are not sure what is the correct answer. So I tell you, if you write down whatever thing you want to write, and then check it out. And so maybe in one source you will find something, in the second source you check, maybe you find the same thing, maybe you find another thing. So you find another. If you search 2 or 3 different sources, you will come to know that what is the correct answer. Okay, and then you can reconfirm it from the whatever source you are studying. So my message, the summary, what I told, try to study topic oriented rather than book oriented. Try to make small points, just like drop of water. If you fill few drops of water together, it can fill the glass. Okay, so similarly, knowledge is not like you just try to grab and eat anything like that. You have to be conceptual. If you have the concept, then I tell you, you will never forget. The thing which you don't have concept, you will forget. That will be volatile, because you are just
As
throwing
you
in.
have quoted that MCQ that 70 years old man is having aortic aneurysm repair. So,
Mhm.
like this MCQ, when I will read this, then I
This is
have
not MCQ.
to
This is not MCQ. This is review books.
that
Okay.
case study. Then
You see,
I should go through the geriatric problems related
yes.
to anesthesia.
Actually, maybe
And
you know. Yeah, sorry, Shimail. I'm trying to understand your question and answer you. That maybe some of the topics you can skip. It's not like a threat on you that you have to do it. Try to gather as much as you can. If you think that abdominal aortic aneurysm is something out of your domain at the moment, just skip out and you just go further forward. You will find, you will find some X-ray. You can have a look on the X-ray. What findings you see? Then you will open it and you will see some ECG findings. Okay, they will explain about this ECG. They will summarize the 70-year-old male patient known to have hypertension and ischemic heart disease, recovering in ICU following AAA repair, has developed hypotension and hypoxia at 24 hours post-operatively following tracheal extubation. His biochemistry results suggest impaired renal function and hypokalemia. This is according to the whole scenario. But for you, what are the, like, for example, you can only take this word hypokalemia. You can explore what are the causes of hypokalemia, what are the what are the findings you get in hypokalemia. What are the clinical signs symptoms of hypokalemia? How to manage hypokalemia? Okay, so this is just, you see, this is, look, again I tell you that looks weird, but after 2 or 3 months, if you keep on studying like that, then you will come to know what I am trying to tell you. Okay, because studies is on according to the patient, not according to the book. That is the biggest reason of failure. When you go in the exam, you will find a totally different world. Okay, that's what you were saying, or I am sorry I interrupted you. Now you can speak out if this was something else.
No, this was my question.
Okay, because in some of the cases, maybe if you go to the next case or next question, because this book is compiled, you see, abdominal compartment syndrome, I'm just giving you example. This is a common thing which can occur in any post-operative ICU patient, or even not surgical patient. If there is any pathology which is increasing the abdominal pressure and it is causing an organ dysfunction. Okay, so if you read about it, then you are in ICU, believe me, because now you know about this problem. In any ICU patient who is decompensating, you will be considering, you will be looking at the abdomen. So even after reading this small thing, you will be able to have a good approach in your patient from that aspect. So similarly, there are things written about, you see here, magnesium therapy. Okay, so magnesium therapy in critically ill patients. This is looking to be a very weird style, but trust me, this is very effective. This is the brain exercise you will be doing it. In one case, of course, you the counter argument for this way of studying is that no, you have to make a concept, you have to have a baseline knowledge. You are coming not from class 5, you are coming from medical school. You are passing through a long passage, and after that you are staging. Is there anything which you have never studied in your life? No. Anything which we are discussing, all of us have studied at some point of time before this point. So you cannot say I don't know anything. This is only because people have indulged in your brain that you are a baby, you are a poor miskin person, you are shudar, you don't know anything. Please don't try to go in something big. This is what unfortunately is poured in our mind. That's why first year resident is looking at the fourth year resident or exam candidate, or looking at me like as if I am alien. No, I am not alien. I'm just giving you the way that if you start like this, you will be much better after 10 years of graduation, post graduation. I did my post graduation in 2013, and I can guarantee you, if you study like that, you will be much better. Even at the end of your residency, you will be speaking like I am speaking. I can bet on it. Okay, because you have the ability. Unfortunately, you are being suppressed. You are being asked, please don't cross your limits. Don't try to read these books. This book is for people who are appearing in the oral exam. What are you doing? Unfortunately, this is what we hear. Okay, so my suggestion is that I will encourage you people to read like this. Okay, so I think some of the senior people, if listen to my discussion, they will be mad about me, but I'm sorry, I have nothing bad about them, but I have good about you. I want all the people who are appearing in the exam to you. I am not getting any penny for making this, believe me. It is for all of you. Okay, there are OSCE books. If you open a resident, I'm just some words for the junior residents. Okay, you will find a lot of things. Like if you open this book, for example, and you will some specific tasks written in such books. Okay, again, the Master Pass series is very good. I think this is from the same series. Okay, so if you just open it and just you will be seeing reading some things about it. Just a second. Okay, so what are the indications? So Like I'm telling you that these books were not there when I studied, believe me. But now I look at them, sir, wow. Maybe you are reading in your Morgan about IGEL, and you are not understanding in the way you can understand from this book. Maybe in a very light way. So you see, you understand. I hope you people are able to use these sources. Okay, this link I send every other day, so you will find a lot of things about X-ray. Okay, if you want to learn about X-ray, for example, you will find something, some presentation, something. But wherever, from whatever source I find anything good, I just put it here. Okay, so it's up to you to use it. Okay, this is these books are about X-ray. Okay, there are some ECG, there are some ABGs. If you want to learn about, just a second. Okay, you will find something about ABGs. Okay, I have discussed these things in different sessions before. Unfortunately, none of you. I'm not because I think some people misunderstand me. It is not for my benefit, believe me. It is for your benefit. You, if you use this link, you will find. And this is the last thing which I want you to open, because it has all the. I think I say these books crap. I cannot write it crap books, but these are the crap books which you people, you waste your time. This is a terrible book. Starting, problem oriented, Morgan, and you will not understand anything. I can guarantee you that if you, this is a book I say that run away from Morgan and stuck in problem oriented. Like in our native language, we say आसमान से घिरा खजूर में अटका. From one problem you are ending up in even bigger problem. Please, I have no conflict of interest from these people, but I'm telling you that this was in the era when you don't have these sources, these articles. Okay, if you want to study, if you go in this, for example, if you want to read about gynae-ops, you go here and you just for example, diseases in pregnancy, you just open it and you find anything you want to know. Management of trauma in pregnancy. Okay, you believe me, this is the same trauma management and same pregnancy changes. The only few things they will highlight it here. Okay, like they have highlighted here: left uterine tilt, assessment of fetal well-being, in a very simple way that you, even if you have a look on it, you will understand that this is the thing which they want you to know. Okay, so this is my message. Please, thanks a lot all of you for tolerating my atypical talk and atypical message, that I'm not asking you to read or worship any specific book. I want you to worship a topic. Worship it in a way that you know from one side to the other side, from top to the bottom, from alpha angle, from beta angle, and then I challenge you that you will be able to answer any question. Okay, so any comment, anything, I will finish, and then actually we will resume our blood which we started in a few days time. I was quite busy, that's why I was not able to take the regular sessions. I will just come back to it. Okay, thank you very much. Any comments please before I finish? Don't be afraid. Even if you disagree to me, I will not say anything. It's democracy.
Thank you.
Dr. Nadeem, if you want to say thanks to me, then you have to participate. Okay,
Okay.
if you are not, if you don't have time for me, it's not my thanks, because I don't, believe me, I am not among those people who want to have a photographic session and put it on Facebook, or I am taking money from you, or I want messages of thanks. I don't want your thanks. I want your participation. I want you to get benefit. I want you to spread this message to others. I want you to be liberated from the spell of these terrible books. This is my message. If you are honoring me that way, that is what I wanted from you. Okay? And that is my thanks.
Okay.
Bye bye.